Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. Today, we are going to talk about a topic that I hear a word thrown around a lot, and I think it's an interesting theme for us to talk about here on the podcast. For years now, people have talked about nurses being burned out and needing to leave their career. And there's been a lot of media, probably in the last 6 years, talking about nurses leaving the bedside, nurses leaving the profession. I have met many nurses that have done that. I've talked to a lot of my students that were considering doing that. I think the reason I wanted to talk about it is because I've never liked the word, and it took me a long time to kind of figure out what it was about that word that I didn't like. I feel like in the last year or so, it's made more sense to me that we are burned out of working in a system that doesn't work. That tends to be the case. And in the last few days, I had some nurse friends over and we were just kind of catching up and talking about the idea of burnout. I was telling them that I was thinking about doing this episode. Two of them are faculty at the school where I did my nursing program. And one of them is one of my good friends that I worked with in the hospital setting. We were talking about the idea of what calls nurses to the profession in the first place. And I've had that conversation with hundreds or thousands at this point of nurses. What brought you to nursing? Everybody has a different story, right? But there are really clear themes that come up the majority of the time. A lot of times people will tell me that they encountered someone caring for a loved one or their own health concern as a child maybe, or a young adult, and that encounter they had with a nurse inspired them to go into nursing, or a family member's medical concern and their desire to be able to offer that kind of care to somebody was a motivator for them. For a lot of us, it is about being able to help people heal and support people in their health journeys and to empower people and educate them. There are several reasons that somebody might become a nurse. What I find interesting when I think about the idea of burnout is that it's the frustration. Whenever I talk to a nurse about it, it's like they're talking about the frustrations of having to work in the medical system. It isn't that they don't want to be a nurse anymore. It's that they don't want to continue to work in a way that doesn't feel right. And I think most of us can relate to the idea of, for example, me back in the day in the hospital setting, wanting to do those other things for your patient that there isn't time for, wanting to provide some education or give them more resources, or feeling frustrated with the fact that somebody is back again with the same problem because of limited resources, outpatient, or they can't get in to see their providers for follow-up, or they couldn't get their prescription refilled, or they couldn't comply with the prescribed diet that their provider may have given them due to finances or some sort of resources or transportation. And the list is long of the many things that we encounter. We want better for our patients. We want better for ourselves. We want to feel good about our work, but also not have it just completely draining us. And one thing that we were talking about, my friends, the other day was what other profession is there that expectation of perfection all the time? And it's not a high number, right? In most other industries, there's some room for error. And there isn't really a lot of room for error in healthcare, particularly like physicians and nurses. And there's that added stress, right? And most of us are caring for people in high acuity settings, or there's high stakes involved in the way that we care for them. And what I find interesting about functional medicine is that we are helping to undo that high stakes, right? Because we're helping people to reverse disease or improve their symptoms significantly. So maybe they need less prescription medication or prevent illness in the first place. There's a lot less stress there, which is interesting. That feeling that I used to have in the hospital setting or in primary care, where I was just like writing prescriptions all day long, that doesn't exist in the functional world to the degree that it did there at all. And so I think that that's interesting. One of my friends was talking about just the idea of when we talk about burnout or dread, like somebody wake up, oh my gosh, I don't even want to go in there. Like I cannot do another shift. And we often think of that as having to work with challenging patients or challenging coworkers or what have you, right? The challenging system, prior authorizations in prescription management, things like that. But she was talking about how she had reached a point where it was even the patients that she enjoyed and the patients that she was typically benefiting from being able to provide care to them. She just felt like she was at a place where she was even checked out from that. And I think that's really common. Then we were talking about what about the way that we talk about our profession, like in school. One thing that I have talked to them about before is in nursing school, we often really just kind of push that nurses are going to go work in the hospital or in a clinic or primary care or specialty clinic or maybe long term care facilities. We don't talk about, as I've said many times, entrepreneurship. We definitely don't talk about that in nursing school. But we also don't talk about a lot of opportunities for prevention or more holistic approaches to care. There are a lot of opportunities for that, and there's a growing demand for it. And I think it's really important. Like if you are working in a school setting and supporting students that are becoming nurses, really creating some awareness about the fact that there are opportunities to be a nurse that aren't, critical care, emergency department, working in a symptom management type approach. So I think that like all of that and the recent conversation inspired me to go ahead and do this because I've been thinking about it for a while. And I really just wanted to talk about the idea of burnout and how I truly feel that it is a misalignment with what called us to the profession versus how we actually live in the conventional healthcare system as a profession ourselves. And burnout could even be considered a symptom of what's going on. And I think that often nurses are told to rest more or have better boundaries or, focus on prioritizing care, building resilience, like spending their days off, restoring themselves enough to be able to come back and do it again. And I feel like that's really unfortunate. I don't think that resilience can fix the fact that the roles that we're working in are pretty much in conflict with what we want to offer our patients in many cases or with our values. And I think sometimes exhaustion is really our bodies responding to this chronic professional misalignment that we are experiencing. And now, a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real time learning, the functional nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. And since most nurses are entering the profession to help people heal, they're wanting to spend time listening to their patients, educating them, and understanding them as a whole person, finding those opportunities to identify what might be going on in their life that could help them to address their health concerns or what they're there to work on. And instead, a lot of nurses are spending their days just rushing through. They're spending a lot of time documenting, doing a lot of tasks, and managing a lot of crises that prevent them in the allotted amount of time that they're given and maybe the number of patients that they need to see that day. They're really limited in their ability to do the things that they want to do the most. It may often feel like they never get a chance to do that. I think there's this like painful gap between what we as nurses hoped our work would look like and what it actually looks like on a daily basis. I think that also a really big factor here is that the conventional healthcare system that undervalues nurses and our ability to truly help our patients heal. They view that time that we might spend there as like secondary or optional. I often say that functional medicine is physicians acknowledging the value of the things that we are skilled to do and are often prohibited from doing time wise or just task wise. We leave nursing school with this awareness of, the holistic approach and educating our patients and thinking about their lives and partnering with them. And then we walk into this system that's like, make sure our patients take their medication, make sure they're quote unquote compliant, make certain they got their lab work done, follow this protocol based on the results. It's task based and really focused on getting people to be compliant with the provider's plan of care. And I feel like that is really unfortunate because it isn't leaving a lot of room for the things that actually brought us to our profession. And yet, a lot of these are the moments that change the patient's trajectory. So we're being held back or restrained from actually offering the care that probably would be a pivotal moment for them if we were able to identify the why behind their health concern. Or, like I often say, one of my favorite questions to ask somebody is what was going on right before that. Creating space to just have those conversations and dig a little bit deeper can be the game changer for a patient. Often, my students that are in the emergency department, for example, talk about how adding that question in to a visit with a patient really changes the trajectory of their care in the emergency department and how they are told to follow up and who they're referred to, and probably recurrent conditions a lot of the time. They're coming in for the same thing over and over again. And this is the first person that asked them why this was going on or what else is going on and identified something that they could actually focus on. And I think nurses are just not simply meant to carry out orders. We're really meant to do this type of work. And when there is space created for it, and I see it all the time, my students, my faculty, my peers, everybody talking about, oh, yeah, now that I'm able to take the time and go through your patient's lab work and hear their story and have a real meaningful conversation with them that isn't like strained and rushed, it changes everything. And so it really is an important example of just this isn't about us not still wanting to be nurses or not still wanting to care for people the exact same way that we did when we started nursing in the first place. This is really about the fact that there isn't room for it and it isn't valued. And fortunately, now we see a lot of patients realizing that there's a better way and they're looking for healthcare providers that can support them in that way. I often say this, so you may have heard this a lot before, that the pandemic created a lot of awareness for patients that there's more than one answer that they might get in the healthcare system. And so gradually over the last several years, I have seen the demand for functional nursing and functional medicine explode. And my students, rather than feeling like they're the only person in their town or in their community or maybe even their state, sometimes their country, that they feel like they're alone doing this. And now they're finding that there's another clinic in town with a really long wait list, and they're excited to finish and see if they can partner with them or offer something that aligns with that as well. So I think that how it has changed in the last few years is really exciting. I think that time and time again, nurses and nurse practitioners have told me that coming to the functional space saved their career, that they were about to quit nursing, go back to school for something else, or, shift gears or something different. Like lots of different ideas they've shared with me of what they were considering doing, and finding the functional approach and feeling excited again about their work saved them from giving up on nursing altogether. And it isn't like it's kind of good now. This is exactly what I became a nurse to do. So I feel like that's really exciting. It's always wonderful to hear students talk about that. And it takes away that what I have seen so many nurses in conventional models not using a functional approach, they feel dreadful about going back to work. They feel emotionally numb and like they've lost their sense of purpose. And so the functional approach and like finding this and getting excited about it and then really seeing patients come back with great results and just feeling so seen and supported is really restorative, obviously for the patient but also for us. And I think that that's important to acknowledge, not just how exciting the functional approach is for what we can offer our patients, but also how exciting it can be for us and our profession. And so I think a lot of nurses that are feeling tired and feeling like they don't know if they can keep doing this and they're new to the functional world, it is really exciting and welcome if you are new. But I think for all of us, it's kind of shifting that conversation. If somebody's bringing up the idea of burnout or nurses just fleeing the bedside and abandoning their career, I think it's great for all of us to have that conversation about what actually called most of us to this profession versus the reality of what we have to practice in generally and how it is so misaligned from who we are and what our calling is. And I know a lot of nurses feel really passionately about their calling to support patients in a way that feels aligned. And so for me, it's just really exciting to think about like the future of healthcare improving and us being able to offer something that we feel better about, that lights us up and makes us want to get up and come to work every day. And also, we're helping our patients have better outcomes at the same time. So, I thought it would be a short episode, but a great theme for us all to think about is just the idea of shifting from talking about this as a burnout problem and really talking about it as us not being aligned with our calling to the nursing profession. So, I hope this was a little bit inspiring for you. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.